Next, I'd like to introduce Louise Parker from the Royal College of Nursing Rheumatology Forum, and really giving us the perspective from a health professional's point of view about supporting people to keep working. Thank you.
Thank you, Claire, Elsa and NRAS for inviting me today. It really is a privilege. So I thought I'd kick off with a brief slide going back to the future. So it seemed for the longest time that employment has been seen as essential and to a rewarding life. And indeed, employment is nature's physician and is essential to human happiness. Bringing us back up to date, this was reiterated in the Work Matters report that you've just been hearing about, published by NRAS a couple of years ago now. This was a hugely comprehensive report highlighting the importance of work on emotional and mental well-being. And as we know, there are recommendations about what government needs to do as well. It was a stark and timely reminder to us as healthcare professionals that we need to play our part and ask proactively about work and concerns that our patients have about their job and their role. It was also a reminder that we're a key part in the patient's care pathway and responsible for prompt referral to other specialties and colleagues that we work alongside, physiotherapy, occupational therapy, of course, just being two of them. While I was doing some reading around the talk today, even more recently, I looked up the Royal College of Occupational Therapists website, and these two phrases were on their front page. Work is one of the most significant determinants of health and life expectancy, and healthcare professionals can give people the skills, belief and confidence to remain in work or return to work, which benefits their longer term health outcomes. I think it's safe to say that the messages across the board are very clear. As we've heard from Professor Walker-Bone, work has a positive impact on a myriad of things: financial security, psychological well-being, how we feel about ourselves, enhanced social networks depending on where you work or who you work with. That might be local, national or even international. That fulfills our independence, personal fulfillment and gives us confidence. And I don't think that any of those can be underestimated. I also stumbled across another article from the Health Foundation published a couple of years ago. And they agreed that all of those things are very important, but it's also important that people shouldn't feel pushed into work that they aren't able or ready to do, or into bad quality work that's harmful, under the misguided notion that any work will be good in the long run. And people with long-term health conditions and disabilities will be able to work if they were offered the right support, the right job or type of work, and the right work environment. And only then would work as a health outcome be a recognition of that. So what can we do as healthcare professionals? We need to be having open conversations with patients about what they want, their expectations around work, and setting goals with them. And doing that, acknowledging that work is a really important part of people's lives. It's imperative to encourage and sometimes perhaps challenge colleagues to do the same across the multidisciplinary team, whether that be in operational meetings, service meetings, networking. And it's also very important, I think, that when we have trainees or junior members of staff working with us, that they see us having those conversations with our patients, and that becomes a normal part of the clinic activity we do. We're also responsible for giving information, good signposting and support in clinic or over the phone. But it's essential that that information and signposting needs to be reliable, up to date and easy to access. Again, as we've touched on, NRAS published two fantastic resources last year, I Want to Work and An Employer's Guide. This covers a wealth of information and resources, including those difficult conversations to have and practical help around communicating the situation to your employer. surrounding what you're entitled to, maybe including PIP queries, and as we've heard again, information around the access to work centres as well. They really are invaluable resources for employees and employers, so people know what they need to be providing and supporting you with. Depending on the size of the companies that people work with, it depends on the occupational health setup and human resources there is available. But if that is available, that needs to be regular in order to be responsive to you and your needs. And we encourage our patients to engage in that proactively and make sure that they attend and update their employers regularly. As we've also heard, ergonomic assessments should be routine. Workstation movement, support for keyboard and mouse work, and chair and desk setups need to be looked at and modified accordingly. I think flexible working, from the patients I speak to, has got better. Flexible working hours, shift work, and working from home, from the feedback I have got, has become increasingly common. Obviously, we're not 100% there yet, and there are jobs where that is quite challenging, but it certainly is increasingly frequent from the feedback I've had. And we, from the hospital I work at, we write medical reports and letters of support an awful lot to the employers of our patients, in order not only to explain in a way that hopefully is easy to understand about the condition, but about the impact it has on the patient's quality of life and their activities of daily living. So they are given as much information as possible, again, to be as supportive as they can for our patients. I just wanted to touch on the support hub at the Royal Free Hospital. I'm not sure how widespread they are, but the feedback from this has been phenomenal. It is designed specifically to support patients with long-term conditions. They are open Monday to Friday and available open door policy, one-to-one sessions, drop-in sessions. They're there for welfare and benefits advice. That can include a one-to-one appointment with somebody who can help you navigate through the paperwork and the policies that are associated with these type of information and benefits advice. And they're there for an informal chat or conversation or general signposting and information leaflets as well. And they run activities and workshop most weeks, again, talking through how you navigate the system. So I think the future is brighter, but I think to achieve the cultural change that underpins work as a health outcome requires change across the health system and the way we think about health outcomes. We need to be very clear that work as a health outcome is not just about setting targets, but about employment outcomes for patients. And as we've heard before, societal contribution, employment, life stability, and rewarding work are all better if flexibility and understanding are in place. Thank you very much.